in accordance with those measures, all of those entities will stay on post and be efficient in its operation. Based on the status quo of our city, some of the citizens are lacking the awareness of self-protection. And in the key risky areas, the medical resources and the information asymmetry are problems. Particularly, there is a rising demand of the stay-at-home hospitalization for citizens. So, to increase the awareness of epidemic control and offer more accessibility of medical resources to the citizens, today we are holding this press conference. We have invited the Municipal Health Commission, the municipal level disease control center to brief us about the updates. Now they are Vice Director Chen Bing from the Municipal Disease Control Director and Professor Liang Zhicong from Guangzhou Traditional Chinese Medicine Hospital, Mr. Yi, and from Sun Yat-sen University, He Ziqing. From the First People's Hospital of Guangzhou, Yue Yiqiang. From the Women's and Children's Medical Center, Professor Wang Hongtao. Also today, with us, we have invited the affiliated Third Hospital of Sun Yat-sen University, ICU Director Wu Benquan, to be with us and take your questions. He's sitting in the first row. So now let's directly enter into the presser. First of all, let's invite Vice Director Chen Bing from Guangdong Municipal Health Commission to brief us about the epidemic control progress. Dear media friends, good morning. Now I would love to brief you about the epidemic control updates in Guangzhou City. About the numbers. On June the 11th, the newly added cases are confirmed at 8, 7 in Liwan District, 1 in Nansha District, Zhujiang neighborhood. For the newly added 8 confirmed cases, they were found in the isolated hotels. And as to the contact persons of those confirmed cases, they are already circled together for observation in the designated hospitals. So, the total cumulative confirmed cases amount to 136. The confirmed cases are 129, 7 are asymptomatic carriers, and all of those cases have been contained in the designated hospital for treatment. Now, as to the vaccination. By the end of June the 11th, the cumulative vaccination number was 14.4 million, and 3.8 million people have completed 2 doses. And to speed up the process of vaccination and reduce the gathering of people, we have the system of appointment. So the appointment will not be made on site. You don't have to line in a queue. And also, in addition to the online appointment, the different neighborhoods will open their hotline calls or WeChat account or the group appointment in the neighborhood together for the second doses. And please pay attention to the notification in your neighborhood. Secondly, we have optimized the appointment hours. Now, in the hospitals for appointment, we have improved the hardware and software for appointment, but in the rush hour, there may be some traffic congestion online, so that is undermining the work efficiency of the hospitals. So we will optimize the appointment hours. There will be designated hour for such an appointment. Thirdly, there will be more appointment offerings for the residents. to better improve the efficiency of those two, they can try to make an appointment where they take the first dose. And we have optimized the 健康通 vaccination appointment system. Recently, we will also launch the appointment functionation where you can make an appointment that you reside in. We have to stay vigilant. You must avoid the gathering of people. Even though you have taken the first dose, you still have to stay vigilant and also have enough self-protection and abide by the rules and orders on site. Let's work together to push forward vaccination work. That's all for my briefing. Thank you. Thank you, Vice Director of Guangzhou Municipal Health Commission, Madam Chen Bing, for giving us the updates of the virus, also about vaccination. Thank you again. Next, let's give the floor to Guangzhou Municipal Traditional Chinese Medicine Hospital representative Zhai Lixiang to brief us about what has the hospital done during this time. Dear media friends, good morning. Now, the epidemic control in Guangzhou City has entered into a critical stage. All citizens must not go out unless necessary, and hospitalization has become difficult. So to meet the medical demand, our hospital made a quick response. We have a campaign called Doing the Real Deeds for the Common People. We have innovated our service model with a modern hospital management added by the Internet Plus, multi-channels, and multi-measures in order to render efficient and timely services for the citizens. Firstly, we have online counseling for the patients. Professor Wang Shuiping, Wu Wanying, and other very famous doctors in traditional Chinese medicine will take questions and counsel for the patients covering tumor, the breast cancer, the skin disease, in total covering 20 different disciplines. Now, 363 doctors have answered questions and counseled for the patients. The total number of counseling reached over 4,000. And Professor Yang Zhiming of our hospital took his team have shared about the climatic conditions and the situation of the cases to compile the 2021 COVID-19 Traditional Chinese Medicine Guideline, covering prevention, lifestyle change, prevention and control measures, daily healthcare, and psychological mentor. And secondly, we have introduced the smart healthcare services during the epidemic in order to offer convenient medical services for the patients. We have established our smart pharmacies. We have streamlined the procedure and increased the frequency of services for the tablets and the other different forms of the medicines. We have increased the processing method, covering about 1.45 million patients. And we have dispatched 3.8 million different doses. As for the Western medicine, we also improved the delivery services. In the first half of this month, we have also delivered 57,000 different traditional Chinese medicines. Thirdly, we have done some online science promotion work. Our hospital has our only video account and official account. We also have a platform on 今日头条, so we could have timely interaction through comments with the viewers. Since June, we have conducted 16 sessions of science promotion and also 12 sessions specifically for the children during the Children's Day. And the total hits reached 350,000. Next, we have taken full use of the group chats of the patients. Those patients may set up their own group chats. Then we can offer some targeted solutions for those patients. For example, there is a very dedicated group chat for the traditional Chinese medicine. In total, there are 70 such WeChat group accounts offering some epidemic control promotion or daily health care benefiting 40,000 patients. We also have a disease management center serving as a platform for the patients suffering from hypertension, diabetes, and asthma, so offering guidance for the patients about their daily care. Since June, for 2,000 people, we have answered questions for mild disease control, and our work has been very well received by the patients. One patient leave comment on our website saying that he has counseled for his mother, and even though it's online counseling, the doctor is very patient and efficient in taking the question. So the timely counseling dispelled anxiety for his mother. So such an online counseling service is warming up the whole city. So he wants to pay tribute to the cutest people in the city. So we do want to give our thanks to all of those citizens for your confidence in our hospital. We will work harder. Thank you, Mr. Zhai Lixiang, for your introduction. Just now, he introduced about the online counseling and science promotion online. Also, for some targeted regions, he has done some prioritized work to protect the safety of the citizens. So thank you for your introduction. Next, let's invite the affiliated third hospital of Sun Yat-sen University, Professor He Ziqing. Good morning, everyone. During the epidemic, Sun Yat-sen University No. 3 affiliate hospital had multidisciplinary team to guarantee the reliability and safety of our measures. Firstly, online hospitals can allow the patients to stay at home for counseling. Ever since the outbreak of the epidemic in January 2020, we had established the method of online counseling, including the repeated counseling, the pharmacy outpatient, in total covering 8 different functions during the epidemic. For the mild disease sufferers to have convenient services, the online hospitals and the small applet on WeChat have been upgraded for their usage. Now the online hospital has 38 different divisions with 364 doctors staying online, answering 130,000 questions. Our online hospital has the following functionalities. First, giving prescription. If in the same division of our hospital you have paid visit, and then if you log onto the online hospital, you can directly be decided as a repeated patient, and then you can get another prescription. And second, quick delivery of the medicine. There are 2 methods of the delivery. The first pathway is delivery through mail. The second is to take it yourself. During the epidemic, most of the patients will choose quick delivery to reduce the gathering. Third, a lot of divisions in our hospital will choose the festivals as a good opportunity to have science promotion or online voluntary counseling. Those counseling is for free for the patients, and the patients can log onto our online hospital through different means. One is to search the No. 3 affiliate hospital of Sun Yat-sen University on our official website, and you can also scan the QR code of our online hospital. In face of the sudden outbreak of the epidemic, now the number of doctors staying online has increased, and they stayed online for longer time. So that is a rapid increase in response to the outbreak of the epidemic. Secondly, we will also highlight the mental help. For example, the psychological help division and the AI team work together to develop a WeChat applet. There is one special part on the small applet to have some mental help and guidance. There is a table to measure your psychological condition, and you can fill the form, and then you can take targeted measures. For example, there are different levels like understanding anxiety, the music, and there are in total 100 different music for the choice of the patients. Also on the applet, there is an offering of individual sanitation guidance, the facial mask 5+5 science promotion. We have made some special slogans to memorize in order to remember how to protect oneself. In 2020, we are going more intelligent. Our hospital developed together one product with the publishing house, with the audio, video, books, activities on the applet, so contributing to the psychological health of the patients. Thirdly, training of the epidemic control. Particularly, we have started the supplementary AI system. Our AI team worked together with the computer science department of Sun Yat-sen University. We utilized the AI programs to guide the medical staff for training. There are some demonstration lessons and alert. Those will help the staff members to scientifically wear their protective clothes and take targeted measures for epidemic control. To guarantee the grassroots level medics could get enough help, our training is coming to the right usage. Thank you. Thank you, Mr. He Ziqing from the number 3 affiliated hospital of Sun Yat-sen University for introducing to us what are the measures taken since 2020, including online counseling and particularly the mental and psychological guidance with the small applet called 月心情. Last year, during the epidemic control in Wuhan City, that 月心情 applet made a great contribution. Now, let's give the floor to Professor Ye Yuqiang from the number 1 People's Hospital of Guangzhou to introduce about online counseling of the hospital. Good morning, everyone. Since we discovered the COVID-19 virus last year, our hospital scanned our services in Wuhan, Guangzhou, Guangzhou, both online and offline. We honored our due responsibilities. In February 2020, to smooth away the services, we have opened our online hospital and offer counseling for free. To Hubei, Guangzhou citizens, we offer free counseling services. In just 1 month, the online counseling numbered 5,000. Since this year, there is a local outbreak of the epidemic. To reduce the gathering of people and implement the measures of epidemic control, in addition to the regular measures of hospitalization, we have upgraded our online hospital. All of our doctors will take questions online. And since June, we have also offered the mild disease control, the cardiovascular disease recovery, and the digestive disease management, and so on. 31 experts are online now, and they are all very famous doctors in their respective disciplines. Our Nansha Hospital is located in Nansha District. Online hospital can offer simultaneous coordination across different districts, so Nansha citizens can also enjoy the services of the municipal level hospital with just one click. And in our online hospital, if you want to ask questions about COVID-19, it's for free. And the online counseling, the prescription taking, and the testing and examination and interpretation of the results can be found on our online hospital. We also have improved the procedure of our medicine delivery. In addition to the regular places, for those places with the confirmed cases, we can also offer the delivery of medicine, so you don't have to step out of your house to get the medicine. Recently, for the digestive disease, elderly care, the women and children care, we have the cloud counseling services. And the famous doctors will stay online to take the questions, so please pay attention to our official account. The First People's Hospital of Guangzhou City is very easy for use. First of all, you can go to the WeChat account to log on to the online hospital, or you can also scan the QR code to enter into the applet. For the official WeChat account and the video account, have some interpretation clips to inform you how to use them. And our QR code can be used by the media friends. Our media friends can help us to introduce to the citizens about how to log online. For the elderly people who don't have the access to smartphones, the relatives or friends may be to their help, and their friends or relatives can register on their behalf. One person can bundle their account with at most 5 different relatives and friends. So all of those measures will offer accessibility of our medical services to the citizens. Thank you, Mr. Nie Yuqiang from the First People's Hospital of Guangzhou City. Next, let's give the floor to Guangzhou Municipal Women and Children Center Professor Wang Hongtao to brief us about the work related to women and children care. Good morning, everyone. According to the arrangement of epidemic control, the Municipal Level Women and Children Center has done stringent measures about women and children care. We have mobilized the medics to participate in the online hospital treatment and counseling services, ensuring the efficient implementation of the measures. Since 2019, our online hospital was established. Now we have benefited 57,000 patients. 270,000 patients have counseled us. And in the past 1 month, the total number of patients asking for counseling online increased over 70%, covering pediatrics and 30 different disciplines. We offer science knowledge covering the breastfeeding knowledge and so on. So our patients can offer professional services without stepping out of their houses. And now we have upgraded our services because we need to learn the exact number of the pregnant women in those affected districts, particularly in the key periods that may undermine the health conditions of the mother and the children. So with the support of the Municipal Health Commission, our center decided to get online a small applet for the services of the pregnant women. Within the first 24 hours of our applet in the risky areas, 5 pregnant women registered, and now the number increased to 2,600. To promote the information, we have dispatched our team of medics to go to the different risky areas to offer the phone call modeling services. There will be more call follow-ups to have feedback from the pregnant women. The hotline will be offered, and there will be 2,000 messages to the pregnant women. Every day, we will counsel 500 pregnant women. So this applet has guaranteed the health and safety of the women. It has become a bridge for the communities, the hospitals, and the patients. Now, 30,000 pregnant women has enjoyed the services from the applet. The community level health center will also connect with the pregnant women, serving as the bond, so the women in this community can have more convenient services. Thank you, Mr. Wang Hongtao. Indeed, during the stage of epidemic control upgrading, the pregnant women living in the risky areas are particularly threatened, so we need to have exact grasp of their condition. Now, this applet has 2,600 registrations from the women, and for 200 pregnant women who is about to deliver, we have offered deliberate counseling for them. So we specifically want to thank this Women and Children Hospital and the Center for offering such precision measure for the pregnant women. Now we will open the floor to the media friends for questions and answers. Just now, with the introduction of the provincial and municipal level medical representatives and the Municipal Health Commission representative, we have learned about the updates of the situation. When the citizens are asking for medical services, they may have some confusions. So if you are paying attention to this presser, you can also leave your comments and questions online. First question from Guangdong Broadcasting and Television. My question is to the municipal level CDC. This new round outbreak of epidemic started from May the 22nd. Now it's already 20 days time, and our epidemic control measures are being readjusted along the way. So for this new round of epidemic control, what is the general effect, and what is your look into the future? Thank you for the question. So now let's give the floor to Director Yang Zhisong from the Guangzhou Municipal Disease Control Center. Since the question is about the epidemic control, I would answer it from the perspective of the onset. Our disease control center has 24/7 services throughout the whole year. Once we receive the reporting of a suspected case, we will conduct the epidemiology investigation, the disease examination, and epidemic control simultaneously. Before the result comes out, the epidemiology team already get online to have the initial investigation, and for the specific places or some clues coming from the patients would allow the government to kick off the control and prevention measure already. And our epidemiology team will ask questions about the medical history and also resort to the big data tools to have a general idea about the tracing and the source of this virus. And then they can get some knowledge about the risky areas and the prioritized group of contacts. And then those information will be referred to the backstage for final conclusion. Then the prevention and control measures will come out. Local government will have timely control and prevention. So the potential risks could be therefore minimized. So, upon publishing the prioritized public places, our citizens must work along. In the past days, have you ever paid visit to those risky places? If we get the information, we can screen the risky people. Since the outbreak of this round of epidemic in Liwan district, we set up an epidemiology center. We put together the municipal level and the district level sister organs and the disease control personnel to establish 39 different panels. Every panel will have 30 experts within 24 hours time according to the standards. Those experts must submit the initial stage epidemiology report. Later on, they will detailize and improve the contents of the report. In the final analysis, the professional epidemiology report will come into being, laying a solid foundation for the prevention and control measures. We serve as the scientific proof for the final prevention measure. So that's my first introduction about how to get clues for the prevention and control measures. And second, enhance our conclusion and management. Once we get to the epidemiology investigation, we have another team of experts to organize all of the data coming in their way. For example, where have the suspected cases or confirmed cases been to, and they can then get straight the tracks and footprints of those patients. They can then come up with the transmission map. For example, in Guangzhou city this time, whether in terms of the asymptomatic carriers or confirmed cases, the gene sequence of the viruses are overlapping. They belong to the same transmission pathway. In the meantime, our risk evaluation team and epidemiology team will work together to analyze any possible change of the virus every day. And they also have a judgment about the direction of transmission and the potential hazards. They will timely organize the features and rules of the transmission and thus offer the categorized and targeted measures for prevention and control, paving the way for the decision-making of the government. I would also love to take this opportunity to call upon our citizens to enhance their awareness of prevention and control and voluntarily cooperate with the implementation of those measures. In our epidemiology investigation, we discovered some facts. Over 60% of the confirmed cases, once discovered with fever, cough, fatigue, throat pain, or any other symptom, neglected the hazard of the epidemic. They thought that they are just getting a cold, so they go to the pharmacy to get some medicine. They failed to pay visit to designated hospital to get, for example, nucleic acid testing. That delayed the time of treatment. It also delayed the time for treatment in a timely fashion. So we call upon our citizens and all the family members to pay special attention, particularly those who have paid visit to Liyuan District, Fangcun District since May the 22nd, and any other highlighted places by the local government. If you've been to those places and you are having the above-mentioned symptoms, please voluntarily register in Yuekang Code to report your conditions. During this Dragon Boat Festival, we hope that our citizens must stay vigilant and be aware of the epidemic. First of all, unless necessary, stay at home. Particularly, do not go out of the city. Second, avoid gathering. Do not hold or participate in some collective activities. Do not knock on the others' doors or have some party. So, social distancing must be on your mind. And last but not least, self-protection. Always wear a facial mask. Wash your hands frequently. Have good ventilation and keep 1 meter social distance. Thank you. Thank you for the question, and thank you, Mr. Yang, for your answers. You've given 3 different measures. First of all, instant epidemiology investigation, and secondly, enhance our analysis and our categorized management. Thirdly, individual participation in the epidemic control. We call upon our citizens to reduce the gathering of people during the Dragon Boat Festival. Thank you, Mr. Yang. Next question, please. From the Southern Daily. My question is to Mr. Zhai. As we know, in Fangcun District, you have a subsidiary hospital. And since that belongs to the highlighted high-risky region, the local residents have strong demand for hospitalization. So my question is about the overall situation in the hospital in that Fangcun district, how to meet the demand of the people living there. Thank you. Mr. Zhai, please. Thank you for your question. The Fangcun Hospital is one subsidiary of our hospital. It's located in risky area. It's located in the southern part of Liyuan district. It's a public hospital, and it falls upon our shoulders to manage it. Particularly the emergency call 120 bus, ambulance, and also the highly dangerous cases rescue and treatment. There are 546 medics, including 143 logistics staff working in that subsidiary. Since May, with the upgrading of the control measure in Guangzhou City, we have done our scientific judgment as well. We are comprehensively implementing the measures required by the Health Commission and the municipal government. We would love to give play to the advantages of TCM, particularly the functionalities TCM shouldered since the SARS outbreak in 2003. Our hospital has accumulated our experience in those fighting. For the fever patients, we have initial stage screening and diagnosis. those preventative measures can reduce the opportunities of transmission. Within 24 hours' time, the TCM ward has been renovated to the screening region for patients. 48 dangerous patients are enrolled. Since June the 4th, the fever division receives over 200 patients per day, including the stroke patients, the cardiovascular infarction disease, and the other patients suffering from the organ failure. Also, we have opened the green channel, saving 16 patients in emergency conditions. In addition to diagnosis and treatment services, the Fangcang Hospital also shouldered the responsibility of the tasks assigned by the Liwan District Health Commission, for example, nucleic acid testing. Since May the 26th, 8,496 vaccines have been offered to the citizens, and since May, we have completed 26,000 nucleic acid testings, and by the end of June the 8th, we have dispatched 12 batches of medics, totaling 165 people to Nanhai Middle School, Zhenguang Middle School, helping 9 schools covering their cafeteria in Dongsha Chajiao neighborhoods to help 55,000 people to complete their nucleic acid testing. Our efficient services have been very well commented by the Health Commission and the citizens. We are like catching up with the virus. The medics have sacrificed themselves to serve the benefit of every individual, and such stories have been covered by the media groups as well. So thank you for giving out the positive energy. And in addition, according to the prevention and control measures, Fangcun Hospital was designated as a specific hospital to treat patients in Liwan District. So we readjusted our treatment accordingly. We set up a tumor chemotherapy outpatient division, and we used to care for 64 patients suffering from the brain disease. Now, we increased the number by adding another 14 patients referred to us from the other hospitals. There are 3 shifts of our staff members in order to take special care of those patients suffering from cerebral diseases. Even though the Fangcun Hospital is located in a risky area, luckily all our medics have returned to their post. We also offer the group management, the head office, our shadow hospital, and the other hospitals coming to help through the phone calls or video conferencing or WeChat. The doctors in the other hospitals offer co-counseling for the specifically dangerous and risky patients in order to guarantee the safety of the medical diagnosis. Thank you for the question. And thank you, Mr. Zhai, for the answer. According to Mr. Zhang, Fangcun Hospital has done a lot of work to serve the people in southern part of the district. During the Dragon Boat Festival, there will be more online services. Next question. From CMG, my question is to Mr. Wang. In the highlighted regions, what is the situation of the medical treatment situation? Mr. Wang Hongtao? Thank you for your question. In this round of epidemic, We have done nucleic acid testing. The daily number reached 8,000, and at the maximum, it reached 10,000. In the required time period, we can deliver the reports. We also dispatched 25 batches of sample-taking medics going to Liyuan, Tiehe, Huangpu districts, including 978 nurseries and 1,000 doctors, completing 330,000 sample taking. Secondly, we have volunteers. To better improve our work, we organized 33 batches of party members to offer voluntary services. In total, the number reached 400 in volunteering services, serving 2,500 hours. Thirdly, saving the international friends. To reduce the misunderstanding among foreigners, our center has an indiscriminatory management method. We have smoothed away the communication channel with the foreigners with translation services, guiding the foreigners to have a registration, appointment making, and also our volunteers have 24/7 services. In different hospitals, we have compiled and published the bilingual service manual in Chinese and English. In our WeChat official account, we also notify the bilingual treatment and diagnosis procedure. For the controlled area, we also pivot our services. First of all, we dispatched 43 pediatrics and gynecologics doctors to Liyuan district. The first group go to Baihedong Health Center. The second group go to the Women and Children Care to offer outpatient and pediatric services. Tomorrow, we will dispatch another 20 medics to 4 big hospitals for support. And we have 60 other experts to go to different districts for the on-site guidance and examination. Thank you. Next question.
谢谢主持人，我是广州台记者，想问一下我们中山三院的贺院。
My question is to Mr. He. You said that there will be some music to offer psychological help for the patients. So, what hit you to develop the music in 月心情 applet?
为什么呢？我们用微信呢来推出月心情，来缓解民众的情绪。
So, what inspired us to use 月心情 applet to improve the mood of the patients? Because during the epidemic, whether it's the citizens or the confirmed cases or the medics, they are quite nervous because they are under huge pressure. So, in the special time, from the perspective of offering real benefits to the citizens, we believe the most convenient method is music. And secondly, the number 3 affiliate hospital has an advantageous division of psychology. We have very professional experts. Last year, during the epidemic, certain divisions have done close cooperation with the division, both online and offline, offering counseling services to the patients. So we have accumulated enough experience. They know what is the best way to help manage the mood of the patients. Thirdly, in terms of intelligence and digitalization development, our hospital is leading the way. We have a treatment and diagnosis center, and 月心情 is one part of that platform. It has been optimized based on our last year's experience. Last year, we already reaped very good results during the epidemic. Our platform allowed the citizens to have first-hand information of Wuhan epidemic situation. It was spoken highly of our citizens, once going to our online hospital, can use some animated measurement form to measure their psychological condition, and accordingly they can choose different music. Fourthly, WeChat is the most convenient communication tool. It can maximize the efficiency of our counseling service psychologically, so it can be of your use to the maximum. As to 月薪情 applet, Mr. He has prepared a small clip. Our media friends can learn about the introduction of 月薪情 applet.
首先搜索医院公众号，点击快速访问，操作网上需要问诊，选择在线专家问诊，选择所需要咨询的科室以及医生。
Choose the division and the respective
点击
doctors.
立即咨询，
Click Counseling Now,
阅读服务须知并确定。
and there will
选
be
择就诊
a
人，
notification.
第一次使用
You
需
can
添加
choose
就诊人
confirm,
信
and
息，
then you can put in the information of the
填写
patient
病情描述。
and describe your conditions.
这里需要上传以往的病历以及相关
Here
资料图片，
is to
方便
upload
医生诊断。
the photos
检查填写
and
的资料没问题就可以点击
medical
提交
history,
了，
and then you can
立即支
submit
付问诊费。
and pay.
等待医生接诊，接下来演示怎样支付药品费用。
Waiting
这
for
里打
the
开医
counseling.
生开出的处方单，
And this is the prescription by the doctor.
选择取药方式二选
Choose
一，
the medicine taking method. There are two different methods.
阅读购药须知并打勾确定。
Read the notification of prescription.
这里确认下信息及药品数
Confirm
量
the
价格，
information,
没问题就
the
可以提
price
交
of the
订单
medicine.
并支付药品费用了。
If okay, you can
立
pay
即
for
支
the
付，
medicine.
订单完成。
Order
谢谢观
completed.
看。
Thank you for watching.
好，感谢何院的回应。我们的提问继续。
Next
好，我们
question.
第二排的这位白色衬衫的记者，通报一下媒体机构。
谢谢主持人，我是南方都市报的记者。我想问一下聂玉强。
From the
是
Southern
这
Metropolis.
样的，就是您刚才说去
My
年2
question is
月
to
份，咱们
Nye
医
Yuqiang.
院已经
As
开
you
通
said
了
last
这个费用
February, your
医院
hospital has
来接受
already
免费
opened
的
the online
线上的问
hospital,
诊我就想问问
offering free
就是本
counseling
轮疫情
services
线
online.
上
My
问诊
question
的
is,
情况
in
怎么
this
样
new round of
咨询人比较
epidemic,
多的主要是
what
哪
is
方
the
面的这个咨询
counseling
另外一个就是
situation
如果是
online?
要去医院
What
看
are
病
the
的话
hot
还需要
topics
注意
online?
哪些方面
And
程序
if
上
the
是不是有一些变化？
patients have to go to the hospital for treatment, so is the procedure the same as before? Mr. Nia, please. Thank you. I said that last February we started our remote counseling services to target at Guangzhou in Hubei province. This year, since Guangzhou has local outbreak of the epidemic, with the confidence and faith from the locals, there are a lot of counseling demand to us. So a lot of the citizens in Guangzhou are using online hospital. In the beginning, we prescribed 30, but now the prescription increased exponentially. But most of the patients counsel the general divisions, for example, the neural division, the skin division, or pediatrics, or digestive division. And the prescription covers mainly the mild diseases, or the patients who have been to our divisions before and who is having a repeated appointment. Secondly, if you have to go to the hospital for the on-site diagnosis and treatment, there will be some special requirements of epidemic control and prevention. If you indeed need to pay a visit to the hospital, you must log on to the hospital's WeChat account to have an appointment. you can also choose to call. And also you have to arrive at the hospital as required in your appointment. And when you enter, please show your QR code, your health code. But some elderly people don't grasp the technique of smartphones, so you can come with your family members accompanying. If not, try to print your health code before you come and take it with you. Our volunteers will help you to go through the procedure. And upon entering into the hospital, keep a social distance with others. And go to the specific division you appointed. Do not walk around and wait in the designated places. And when you are lining, try to keep a distance of over 1 meter. And also when you are sitting in the waiting region, also sit remotely from others. You have no more than 1 family member to accompany you.
好，感谢媒体的提问。
Thank you for the
看看我们
question.
市医是否也有一些我们网上问诊，或者说我们网上
Now
医院
let's
的
see
相关的
if
视频介绍。也请工作
we
人员
have
来给
any
我们
clip
播放
and video
一下
about the online
广
hospital.
州市第一人民医院拉响迎战役，线上互联网医院升级改版，更多服务等你来看。您好，我想了解一下互联网医院。
Hello, I want
好
to
的，
get
请
some
您跟我
information
来。
about the online
让您
hospital.
足不出户
Okay,
就能
please
享受
follow
名医
me.
问诊，
You can enjoy
免费
the
答疑
counseling
相关
from
的
the
会员问题，
experts without
提
going
供线上
out.
复诊、续方等服务。
We offer
在此推
services
送大
like
家
online
进行风控
counseling
及
and
问答。
prescription,
这个太好了，我要怎么操作呢？
medicine delivery.
别急，让我慢
But
慢
how?
告诉您。一直接扫描下方二维码进入
Please
小程序。
scan the QR code to
按关
enter
注
our
市医院
applet.
服务号进入互联网医院，
Follow our online hospital
点
applet.
击线上门诊，
Click
选择
online
需要就诊的科室及医生，
outpatient. Choose the division and doctor.
进行线上
Cancel
问诊，
immediately.
选
Online
择取药方式，
outpatient. Choose
确认
the
信息后
delivery
点
method.
击立即支付，
Confirm the information.
完成了。
Pay. And
就医新技能，
it's done.
您 get 到了吗？
好，感谢今天出席我们发布会的所有的我们
I would
卫
love
健
to
委
thank
市疾控中心
all
和
of
省
the
市医院的
experts
相关
from
负责同
the
志给我们带
municipal
来了
CDC and
非常
Health
及时
Commission
的网
and
上就
the
医
different
问诊的
hospitals
相
for
关的情
bringing
况。
us such immediate information
各位
about
媒体朋友
online
们
counseling and
有句话
treatment.
说得好，医者仁心。
As the saying
全
goes,
市的
the
广
doctors
州地区
have
的
a
广大
kind
的医务工
heart.
作者，在我们的日
All
常
of
生
those
活中给
medics
我
in
们带来
Guangzhou
了健
City
康的保障，
have brought us
特别是
health
在疫情防控期间，
safeguards,
他们
particularly during the
勇担
epidemic
责任，
period.
白
They
衣之下
shoulder their
地下而行，
responsibilities.
在与时间赛跑，在与
They
病魔
walk in
较
the
量。
hero's way,
他们
and they
奋战
are
在我们疫情防控
fighting
的第一
against the
线，
time
在
in the
疫情防
front
控我们
line
的核酸检
of
测，我们
epidemic
的
control.
重点的医
For
院的门
example,
诊，
nucleic
特别
acid
是我们
testing
和预防
outpatient
的
in
相关的
designated
繁重
hospitals,
的
particularly the
艰难的这
quarantined
种
wards.
救治工作中，
They
在
are doing such
这里评估，他
tedious
们呢
and
也在
dangerous
创新
work.
方式，为
They
我
are
们城市的
laborious and
平
they are
安带
innovating
来了我们
to
更多的
safeguard
线上
the
的问诊服务。
life and safety of the
在
whole
端午佳
city.
节到来之际，也问候广大
Now
的
is the
医务人
Dragon
员，
Boat Festival. I would love to
问
give
候我
my
们为这
greetings
个
to
医务
all
人
of
员的
those
服务的
medical
我们
people
背后的广大的技术人员的支撑，
and the technicians behind those
小小的
first
肩膀
line doctors
和
and
这个城市
nurses.
的平安，
With
献
your
献
due
我们
contribution,
重要的
the
一个种子。
safety of the
再次感谢，
city
也感
is
谢
guaranteed. Thank you again. I also want to thank our media friends
问候我们的媒体朋友们，解释
and